Today I will briefly introduce the medical application mechanisms of pharmaceutical-grade ferric citrate based on the patent. The key concept is that ferric citrate is not positioned only as a chemical ingredient, but as a pharmaceutical-grade compound with controlled quality, dissolution characteristics, and clinical relevance. The main medical pathway is phosphate binding in the gastrointestinal tract, which leads to lower serum phosphate and lower calcium phosphate product. From this core mechanism, we can further discuss three important medical implications: dialysis outcome-related risk factors, calcification-related risk factors, and citrate-related kidney stone risk mechanisms. From a medical perspective, the value of this product is not simply that it contains ferric citrate as a chemical ingredient, but that it is a controlled, pharmaceutical-grade phosphate binder suitable for medical use. Importantly, this also differentiates the product from general food supplements. Nephoxil has a significantly larger active surface area, more than 15-fold higher than that of general supplement grade. These characteristics are medically important because ferric citrate must dissolve properly and expose sufficient active surface area in order to effectively interact with dietary phosphate in the gastrointestinal tract. The central mechanism starts in the gastrointestinal tract. After oral administration, ferric citrate releases ferric ions in the GI tract. These ferric ions bind dietary phosphate and form poorly absorbable complexes. As a result, less phosphate is absorbed into the bloodstream. This leads to a reduction in serum phosphate levels. When serum phosphate decreases, the calcium phosphate product also decreases. This is the most direct and defensible medical application of ferric citrate: management of elevated serum phosphate in CKD, ESRD, and dialysis patients. The central mechanism starts in the gastrointestinal tract. After oral administration, ferric citrate releases ferric ions in the GI tract. These ferric ions bind dietary phosphate and form poorly absorbable complexes. As a result, less phosphate is absorbed into the bloodstream. This leads to a reduction in serum phosphate levels. When serum phosphate decreases, the calcium phosphate product also decreases. This is the most direct and defensible medical application of ferric citrate: management of elevated serum phosphate in CKD, ESRD, and dialysis patients. The second medical implication is related to vascular and soft tissue calcification. High serum phosphate and high calcium times phosphorus product create favorable conditions for calcium phosphate deposition. Over time, this may contribute to vascular or soft tissue calcification risk. Ferric citrate reduces phosphate absorption from the gut. This lowers serum phosphate and subsequently lowers calcium phosphate product. Another important point is that ferric citrate is a non-calcium phosphate binder, so it does not add extra calcium load like calcium-based binders. Therefore, the recommended positioning is that ferric citrate may reduce calcification-related biochemical risk factors, rather than directly claiming that it reverses calcification. For kidney stone risk, pharmaceutical-grade ferric citrate may be explained through two complementary mechanisms. First, ferric iron binds dietary phosphate in the gastrointestinal tract, reducing phosphate absorption, serum phosphate, and the calcium phosphorus product. This may help lower the biochemical conditions that favor calcium phosphate deposition and crystallization. Second, citrate has an alkalinizing effect and may help correct overly acidic urine, especially in uric acid stone risk. Therefore, ferric citrate can be positioned as a mechanism-based supportive option for stone risk management. Ferric citrate is more than a phosphate binder. By reducing gastrointestinal phosphate absorption, it helps lower serum phosphate and calcium phosphate product, supporting phosphate-related risk management in CKD and dialysis patients. Its citrate-related calcium binding mechanism also provides a scientific rationale for stone risk support, especially in patients with calcium oxalate stone risk. Under physician's clinical judgment, off-label use may be considered for patients. who need phosphate reduction and have calcium oxalate stone concerns. Together with clinical findings suggesting potential CKD progression-related benefits, ferric citrate offers a compelling, one-drug, multiple benefits profile. Agency and distribution opportunities are currently open for Southeast Asia, Australia, the Middle East, and other selected markets. Thank you.